Another source of contact allergy in the skin can be from an ingredient found in a lot of skincare products called lanolin. Lanolin is often added to products, especially skincare products, to give it more of an adherent property as well as more of a thickening effect on those products. Lanolin is also referred to as wool alcohol simply because it is derived from the wool from sheep. Now, this doesn't necessarily mean that if you have a sensitivity to wool that you will have a sensitivity to lanolin, because also do remember that the studies that are out there that have evaluated skin sensitivities to wool have demonstrated, especially to sweaters and other type of textiles, that the sensitivities are more based on how coarse or thick the wool fiber is, and that we see a lot less sensitivities with thinner fibered wool, such as merino wool. So you're not always going to find a connection between a wool sensitivity and lanolin itself. But where do you find lanolin at work and at home? Work, it all depends on the type of work that you do, but if you do come into contact with various lubricants, waxes, polishes, printing inks, there is a chance that you could come into contact with lanolin. Various veterinary products, hand lotions, hand products will often have it in there as well. Now at home, you definitely run a high risk in your personal care products of finding lanolin in there. So definitely looking through the ingredient labels is important for various personal care products. And this would range from things like creams and lotions, as well as moisturizers, shampoos, conditioners. You may find it in diaper rash creams, baby products. You may also find it in things like hemorrhoid preparations, nail polish removers, also within shoe polishes. You may also find it in other products that might have more of an adherent property to them, such as face masks, as well as sunscreen products. In my practice, I have definitely come across patients that have tested positive to lanolin. It is on our traditional patch test panels that we perform in the office. I've had patients who in practice will say, they're constantly using moisturizers to calm down hand dermatitis or other rashes and find that their rashes get worse. Sometimes they'll put their product on and it feels good instantly, but then over repetitive use, it keeps getting inflamed and it gets confusing as to why their products are not helping. In these cases, sometimes we will find that they're actually allergic to the products that they're using to treat their skin, and we have to try to identify and remove some of these sources. Now, there are a variety of names that lanolin can go by on a package insert, so you want to look through the ingredient label for any of these names that you might come across, recognizing that any one of these could be a synonym for lanolin, and identifying that source is always important, and recognizing that different companies may refer to it by different names so that you can identify it faster in your products. I have had some patients that really find it challenging to avoid lanolin in their environment, either because of the work that they do or the types of products that they find themselves drawn to. And we do have various ways to manage these patients. Once we've identified lanolin as a contact reaction in the environment, it's more of a matter of sitting down and looking through your product labels and before you purchase products to see if any of those ingredients are in there. We can often find alternatives for our patients to try, but if we really do struggle, there are various other types of treatment approaches that we can take as dermatologists, so it's always worthy of talking to your dermatologist about various options to control your cutaneous disease.